Please come to order. Good morning. Welcome to the Commissioner of St. Mary's County meeting this date, Tuesday, August 31st, 2021. I am Randy Guy, President and Commissioner of St. Mary's County. I'd like to introduce the other commissioners. Sitting to my right, representing the 1st Commissioner District, which includes Ridge, Piney Point, St. George's Island, Mr. Eric Colvin.
Good morning.
Representing the 2nd Commissioner District, which includes Leonardtown, Hollywood, Mr. Mike Hewitt.
Good morning.
John O'Connor, who represents the 3rd Commissioner District, which includes Charlotte Hall, 7th District, Golden Beach, and Mechanicsville, is unable to be here today. Todd Morgan, who represents the 4th Commissioner District, which includes Lexington Park, some of California, Great Mills, and some of Hollywood, is also unable to join us today. Dr. Rebecca Bridget, our County Administrator, is sitting at the table to my left.
Good morning.
Elisa Casas, our Communications Director, is sitting at the table to my right.
Good morning.
Amy Carter, our Video Media Producer, is behind the glass. Please turn your cell phones off or on vibrate. When you come to the presenter's table, please approach by coming down the center aisle. And remember, this meeting is being televised, so you need to speak clearly and directly into the microphone for recording purposes. If you're wearing your mask, please get close to the microphone so we can fully understand. At this time, we'll have the Commissioner Colvin will give the invocation and pledge. So please stand.
There you go. Almighty God, we lift up those struggling in our nation today. We lift up those struggling from the storms, from illness, from depression, and other struggles that they may be dealing with. We pray, Lord, that you would be with us during our meeting this morning, that you would guide our decisions. In your name we pray. Amen.
Amen. Amen.
Please join me in the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Commissioner Colvin.
Thank you.
Next, we need the approval of the consent agenda.
So moved.
Second.
Have first and second, all in favor?
Aye.
Aye. Ayes have it. Okay, we have a couple of proclamations today. As you're aware, this is also Suicide Prevention Month, and we'd like to have those who are representing our medical staff, Dr. Brewster, I think Tammy Loy, I'm not here or not, but Stephanie Thomas, please all come forward, and we'll have the proclamation.
And it looks like, Commissioner Guy, there's a couple people on Zoom to receive this also. Natalie Miller, the Mental Health Promotion Coordinator, Alexandria Walker, the Suicide Prevention Community Engagement Specialist, and Indu Radhakrishnan, the Suicide Prevention Training Coordinator and Data Specialist. So they're all on Zoom. So welcome. Thank you for being with us. So this proclamation reads, whereas suicide remains the 10th leading cause of death in the United States and the 2nd leading cause of death among individuals ages 10 to 34, and over 47,000 people died by suicide in 2019 according to the Centers for Disease Control, and whereas in 2019 657 people died by suicide in Maryland, and suicide was the 11th leading cause of death in Maryland, and whereas over 90% of the people who died by suicide have a diagnosable and treatable mental health condition, although often that condition is not recognized or treated, and whereas organizations such as the American Foundation for Suicide Prevention are dedicated to saving lives and bringing hope to those affected by suicide through research, education, advocacy, and resources for those that have lost someone to suicide or who struggle, and we urge that we recognize suicide as a preventable national and state public health problem and declare suicide prevention to be a priority, acknowledge that no single suicide prevention program or effort will be appropriate for all populations or communities, address the disparity in access to mental health care for underrepresented groups, and advocate for ending these disparities, promote awareness that there is no single cause for suicide and that suicide most often occurs when stressors exceed the coping abilities of someone struggling with a mental health condition. Now, therefore, we, the Commissioners of St. Mary's County, do hereby proclaim September 2021 National Suicide Prevention Month in recognition of suicide as a public health issue for which everyone has a responsibility to prevent, and in support of families and individuals affected by suicide, and do encourage all citizens to seek help when needed. Thank you. Would any of the people in the Zoom like to make any comments?
I guess just thank you, and we love that we get to partner with St. Mary's County for suicide prevention initiatives.
Good.
Very good.
Anyone else? Ladies? Anybody else? Dr. Brewster?
Sure, just wanted to say thank you very much for your support and recognition of this as a public health issue, and I'll defer to Tammy Lowy, our Behavioral Health Director, and Jamie Barnes.
Actually, Jamie's going to.
Jamie Barnes.
I just wanted to say thank you. St. Mary's County Health Department is dedicating to reducing suicide rates in our community, and we're looking forward to working with all of our partners. And please remember to wear yellow on September 10th in honor of Suicide Prevention Month. Thank you.
September 10th.
Anything else, ladies? No. Well, thank you very much
Thank you.
Thank
for
you.
your work.
Stand for a picture.
And for a photo op here now.
Well, you all can stay here, as we have another one.
Yeah, I think you guys are doing it
Okay,
again.
next we have the National Recovery Month.
Oh,
Of course, St. Mary's County Health Department, Dr. Brewster, Tammy Lewis, Stephanie Thomas, all of y'all just stay up here.
And we're all wearing purple in honor of Recovery Month. So, this proclamation reads, whereas Recovery Month works to promote and support new evidence-based treatment and recovery practices, the emergence of a strong and proud recovery community, and the dedication of service providers and community members across the nation who make recovery in all its forms possible, and whereas this observance celebrates the millions of Americans who are in recovery from mental and substance use disorders, reminding us that treatment is effective and that people can and do recover, and whereas Recovery Month also highlights the achievements of individuals who have reclaimed their lives in long-term recovery and honors the treatment and recovery service providers who make recovery possible, Recovery Month also promotes the message that recovery in all its forms is possible and encourages citizens to take action to help expand the availability of prevention, treatment, and recovery services for those in need. And whereas since 1998, Recovery Month has inspired millions of people to raise awareness about mental and substance use disorders, share their stories of recovery, and encourage others who are still in need of services and support. And whereas Recovery Month serves to help reduce the stigma and misconceptions that cloud public understanding of mental and substance use disorders, potentially discouraging others from seeking help. Now, therefore, we, the Commissioners of St. Mary's County, do hereby proclaim the month of September Recovery Month and invite the community, namely our treatment and recovery support providers, St. Mary's County Health Department's Behavioral Health Division, Pyramid Walden's Beacon of Hope Recovery Center, The Cove, Project Chesapeake, Outlook Recovery, Maryland Coalition of Families, On Our Own of St. Mary's, and all the private community providers to celebrate the strength and achievements of those currently in recovery and those who have come through recovery today. Thank you all.
your turn now.
Dr. Brewster, why don't you start off again?
Yep, sure. Thank you, Commissioner, very much. And absolutely, thank you for wearing purple today. And as we launch into National Recovery Month, we certainly appreciate the community coming together to support those who have committed to a path of recovery from substance use. I'll turn it over to Tammy and Stephanie, who can speak a little bit more about the month and the activities we're planning.
So we're just excited to have Go Purple in our community, and we look forward to continuing to work with all of our partners and bring different events and recognition to not only September, but throughout the year. And so we just want to thank all of our partners for all of the work that they do to help individuals going through the path of recovery, whatever that may look like for that individual. Thank you.
Anything?
Thank you very much. Go Purple.
Thank you.
Anybody online have anything? Is anybody online that we missed? I will say that the county, we have spent a lot of money to do just that. And the thing is, the retention center, all that we put up there to help, we understand that even though they may get in a little trouble, we need to treat them because they're going back to society and back into our community. And it's important that they have a good start back into life again. And I appreciate all the work that all of you all do to help us do that. Thank you.
Thank you, sir.
Thank you.
Get our picture taken
All right.
again?
Picture taken now?
Thank you all.
Thank you.
Thank you all very much. Thank you. Okay, next we need to adjourn as Commissioner St. Mary's County and convene as a Board of Health.
I motion that we adjourn as the Board of County Commissioners and reconvene as the Board of Public Health.
Second.
First and second, all in favor?
Aye.
Any nays? Ayes have it. Dr. Brewster will now, and I think Dr. Michaels, is he here? And will give us a current briefing on the virus as we know. And hopefully, both y'all can settle some conflicts that are out there in the press as well as in the latest news.
Morning.
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 How are you?
Welcome, Dr. Michael.
Thank you.
Good morning, Commissioners.
Morning.
Thank you for your time this morning, and appreciate all the conversation we had at our last Board of Health meeting as well, a couple weeks ago. Today, we'll just do a data update and then talk into a couple of new announcements, new updates that we've had in the past couple weeks. And again, appreciate Dr. Michaels, our Chief Operating Officer, Chief Medical Officer with MedStar St. Mary's Hospital, for joining us today. Can you go to the next slide? So, Commissioners, my intent today is not to go through every data point that we have available. As you know, we maintain a variety of data points on our data dashboard, which is linked here. And we update this 7 days a week, thanks to the awesome hard work of Dr. Jessica Malish and our data team, who's doing this and reviewing all the data on a daily basis. We go to the next. We are still in high COVID transmission here locally, and we're continuing on the next slide to see a rise in the number of new cases per week, as indicated here on this graph. Our new case rate continues to increase, and we are approaching the highest peak of what we had previously seen in the pandemic, right around the post-holiday time period in the beginning of 2021.
Dr. Brewster, could I ask you real quick? I see this data for these transmission rates, and I'm sure they're continuing there, but they're through August 8th. And today's, that's like...
So no, this has been updated, and the data point last year...
Maybe I'm looking at the wrong one.
Yeah, you have to, when you go to the data...
08, 309 cases.
So if we go to the prior week, the new cases by week, that
Yeah, so
graph
that's
here...
the August
it up.
21st.
Yeah, so that's the beginning, that's the date that starts the week.
Okay, all right.
So that's the date that starts the
Got the
week,
one
and then there's a middle column. We don't have room on the x-axis to
I had
label
the one
every
that you
week.
sent out on Thursday. They gave me the new one. I grabbed the wrong one. Sorry.
Okay, no
Thank
worries,
you.
that's fine.
right.
The middle columns are not dated, just because we don't have room on the x-axis to list all the dates.
So the new, it's up to 370 now. Okay.
Yes, 370 as of the week starting 8/22, so the week we just concluded.
Thank you.
If you go to the next slide, please. And again, we already did this one, if you want to go to the next one. This one breaks it down by age groups, and we're still seeing the highest new case rates in our 20 to 39 age group, and the one that's increasing most rapidly. However, the other age groups are not far behind, and the lowest new case rate so far has been in the 60-plus age group. And that correlates with the higher vaccination rates we see in our older population. Next, please. This is a breakdown of the 136 deaths that have occurred in St. Mary's County residents. So these are individuals who've identified St. Mary's County residency on their death certificate. Next, please. This graph details out the daily number of St. Mary's County residents that are hospitalized related to COVID-19. Again, this includes Maryland hospitals, but it does not include federal facilities like the VA hospitals. Dr. Michaels, of course, is here from MedStar St. Mary's Hospital to talk a little bit about the impact of COVID-19 on our local hospital, as well as our local MedStar healthcare system, which, as you know, is the prime healthcare delivery provider in our county.
So if we're saying there's 20 people in the hospital, that's in the state of Maryland?
Correct. That does not include federal facilities like the NIH or VA hospitals.
Should we expect that to be higher then?
If there are hospitals, we don't get that data, so we can't speak to that. If you go
But
to
again,
the-
this, sorry to interrupt.
No problem.
This 20 number, we can't correlate that necessarily with St. Mary's Hospital here because MedStar transfers patients around. There could be patients that have been transferred here versus
Correct.
St. Mary's County residents that have transferred to other hospitals.
Right, so this would include Maryland hospitals that are reporting, and sometimes this data, obviously this data is a little delayed. We're here on 8/31, but the latest data point we have is the 25th. So we usually get the data the following week, and then periodically the data gets updated as hospital records get updated to, when they go through their charge sheets and everything, they correct things, and we'll get changes in the data from that as well. If you go to the next slide, and this is where Dr. Michaels was hoping to speak a little bit about the impact of COVID-19 on our hospital and our healthcare system here locally. Just a key point, as we've talked about for some time now, that the main health outcomes of concern related to COVID are not just about hospitalizations and deaths, although those are two critical factors and the ones we paid the most attention to at the beginning of the pandemic. We are looking at the impact of COVID on our entire healthcare delivery system and our healthcare workers who, for 18 months now, have been working nonstop and certainly are putting their own lives at risk in exposure to this virus. And so that's why when we look at the impact of COVID on our healthcare system, we have to go beyond hospital beds, although that is a critical factor. And we have to also look at what's the load on our emergency department, in our doctor's offices, and our urgent cares. How is it affecting our long-term care facilities and their ability to accept new patients? All of that. And of course, all the healthcare workers that are involved in those elements of the system. Mortality is a key metric, as I mentioned, that we've been following. Fortunately, since we've been rolling out vaccine, we have seen the rise in mortalities drop dramatically. And we're still, of course, concerned about the half of the population who's not yet vaccinated. And then, as I spoke about in our last Board of Health meeting, the morbidity or the impact of the disease that's not just about fatalities is the complications of COVID illness, and then the potential for long-term COVID, or long COVID as we call it, where people still struggle with COVID symptoms for many months, perhaps longer. And we're now learning about potential impacts of the COVID infection on different body systems and how those impacts or those health impacts can be realized later on in life, including inflammation in the nervous system and other organ systems. So Dr. Michaels, if you wanted to speak a little bit about the healthcare system.
Sure. So I just have a couple comments to make. I think it's very important to understand why there's a huge push to get COVID, the incidence of COVID way down, okay? And I'm not sure that this is as talked about as frequently as it is, but you have to understand that the Delta variant occurred where there was a huge population of unvaccinated people. So every time somebody gets infected with Delta, there's a fractional percentage that the virus is going to mutate. Okay, and so right now we're looking at the next generation of mutations which are coming up. So there's the Lambda mutation, which is coming up. There's a new mutation that's just been identified in South Africa. So the way to really get COVID out of our system, and so that we don't see graphs like Dr. Brewster showed, where we see peaks and valleys and peaks and valleys, is to get the population vaccinated such that there isn't an opportunity for the virus to continue to mutate on a regular basis. So even if we said, well, it's just a cold, or people say, oh, it's not that bad, or we don't need to worry about it that much, at some point there's always the possibility that it could mutate into a form that is very virulent. And so that is what the push to make sure that vaccinations really become a mainstay of preventing large populations from getting disease. That's why wearing masks is important. This isn't a statement about where you feel about personal liberty or anything like that. It's about the science of mutations in viruses. So I just wanted to say that because I don't know that everyone appreciates the reason that we keep seeing these peaks and valleys. And, so the next, in South Africa, I just read today, there's a huge population of unvaccinated people. It's going to run through that population. The chances of another serious variant coming out is high. So that's why it's important, and probably will be important for the next couple of years to really have very high vaccination rates. And also take precautions around transmissions. What I can tell you locally is that this summer, at the hospital has been the busiest summer that I've ever seen, and I've been here 11 years. We've had sustained high volumes of people at high acuity, not necessarily related to COVID, although COVID cases have been going up, and they've been going up dramatically over the last couple of weeks. So we were in, relatively low numbers, below 10. Then we went over 10. Now we're over 20. And so we've got significant cases in the hospital, because when you think about the number of medical surgical beds that we have at MedStar St. Mary's, when you're getting into the 20s, you're talking about 30+% of our medical surgical beds being COVID related. So it's not insignificant.
30%. 30% you're saying?
Well, I mean, when you start to get into the, above 20, I mean, we have 125 beds. They're not all medical surgical. Some are OB, some are psych, some are peds. So when you talk about the medical surgical beds, you're starting to talk about a significant percentage. I'm not putting an exact number on it, but it's roughly in the 30% range of the medical surgical beds are going to be COVID related. Now, as it drops down, obviously that percentage goes down. But to the point that Dr. Brewster was making, the problem is that the system is it's a train ride, and we can stop the train ride at any point. So right now, as of yesterday, and I don't know what the numbers are today, there were 5 nursing homes in the Southern Maryland region that were shut for COVID-related reasons. So COVID and staffing-related reasons. So if we can't offload subacute patients out of the acute care facility, we're going to load up again, and eventually we'll be in a situation where we can't take any more because we're stuck with patients. Somebody mentioned that MedStar is a system, and MedStar itself is also across the state inundated with patients, and we're not accepting any patients down. We're only offloading patients because we're so busy. We've had sustained volumes of over 100, 110 patients, and sometimes we've had patients over 130 to 135 patients, and we have 125 beds. So it's been a very, very busy summer at MedStar St. Mary's, which is different than our usual situation. Our usual situation is we see a significant decrease in volume over the summer. Our busy times are usually during the flu season between November and April.
So Dr. Michaels, real quick, could some of that possibly be attributed to one of the other side effects of COVID, in that people put off medical care and treatment during the worst of the COVID pandemic, and now that's coming to pay a price and they're requiring more care and stuff now? There
certainly could be a component to that. You can't put off, ischemia, which is the lack of blood flow to your heart. You can't put that off. I mean, you're going to come in. Or if you've got peripheral vascular disease and you're not getting enough blood flow to your legs, you can't put it off too long. I mean, you can put off some elective stuff, but I can tell you that our elective surgical schedule has been steady, and we haven't skipped a beat in terms of being able to deliver elective surgery. But I can tell you, if it gets to a sustained situation, at some point we're going to have to say, we're going to have to postpone elective surgeries. Now, we're not doing that yet, and I don't anticipate that. Obviously, this is a warning that we need to be as careful as we can about this. And the concern that I have when I look at the statistics across the state is that St. Mary's County has a very, very high transmission rate, and likely related to the vaccine penetration within the community.
The unvaccinated, you mean?
Yes. Yeah, exactly. So, I mean, I talked about, the concerns about, how we should address the concerns that people have about, well, this isn't as serious as it is. But I can tell you that knowing what the biology and what the medicine of viruses are, this is still a very dangerous situation. And I know that people are tired of it and fatigued, and I'm tired of it, believe me. I wish COVID, we could get it under control, because it is a stressor to the healthcare system. But until we actually get to the point where we stop transmission of the disease, we're going to continue to see these skirmishes that we're going to win. And then obviously the black cloud or black swan situation would be where there's a variant that's really, really virulent. So those are the things that we're working on. So in terms of what we're doing at the hospital, in terms of active treatment, there are some active treatments out there. There are monoclonal antibody infusions, and I know that people were concerned that monoclonal antibody infusions weren't readily available. The hospital ER is giving monoclonal antibodies. We've been doing it in the emergency room. That volume has grown significantly. Concerned to the point where we're going to open a monoclonal infusion center for a short period of time if we can continue to staff it this Thursday. So we'll open a monoclonal antibody infusion center at the hospital starting Thursday. We'll run it. The schedule will be announced relatively soon, and we'll run it out of one of our buildings there. The temporary buildings were helpful. One of them is being torn down because it's not really adjacent to the hospital, and at this point we haven't needed it. The other three buildings we do use. There are some limitations to them in terms of temperature control and stuff, but we are using them, for example, by running a monthly blood donation center. There's a national shortage of blood, and MedStar St. Mary's wants to be blood usage neutral. In fact, we are contributing to the overall blood supply in the state. We don't feel like we can use them right now during the peak heat season here, but probably as the temperature starts to break in the fall, we'll be able to use them again, and eventually we'll have them decommissioned as we no longer need them. So I'm going to stop there and see if there are any questions. I think, is there any subject that I didn't touch on, Dr. Brewster, that you want me to?
Thank you. And we'll talk a little bit more about monoclonal antibody infusion in a moment as well.
All right, I have several for you. First off, I'm totally vaccinated.
That's good.
I believe that I have to do my part to make sure that I don't transfer the disease, that I don't get disease. Now, it's not about it's about us, we. Many people have reached out to me to say, Mike, what happened to the flu? We used to have the flu every year, and we'd get flu shots, and that's something we dealt with. We used to have common cold, and people said that's what we dealt with. Many of these symptoms they're getting today are similar to those symptoms. So the point gets to be, every time you feel like maybe something's you got a cough, or you got to run and get a test. And people tell me they go get tests, they get that, what's it called, PCR test, and it comes back negative, but then something gets sent somewhere for a longer testing. Comes back positive. Their families, their kids, their work environment comes to a halt. I'm not trying to say there's anything wrong with that, but there's a little bit of confusion about who are we supposed to, when are we supposed to go? If we just feel bad, there used to be a term called hypochondriacs, and they were always sick, or something was always wrong, and we got to take them with a grain of salt. But now it seems like every time someone's got a mild fever or a sore throat or a cough, man, we're running over to get a a test to make sure we don't have COVID.
Well, and you raise an important point, Commissioner. Thank you for raising that. I think we're in a state where we have high community transmission of COVID. We have very high numbers of people getting infected with COVID. They have close contacts. We're going into a state where, as I mentioned before, in another few months, we're going to be an indoor season where a lot of people will be congregating indoors, and there'll be even more spread of virus in that type of environment if people don't use certain mitigation measures. And so those are, in an environment where we have high community spread of COVID, people do need to be sensitive to their symptoms and understand that their symptoms could be COVID symptoms, and there's a whole list of COVID symptoms that are, as you mentioned, very similar to what we see with some other things like various types of colds and the flu. But it is prudent for people to get tested in this environment, because if they do have COVID, right? If they do have COVID, there's potential actions to then take for the protection of others and for their own health and for their own healing from COVID. And so those, being able to identify when somebody, that test, trace, isolate process is such a critical component of controlling the spread of disease in this county. So if people have symptoms that are consistent with COVID at a time when we have a very highly contagious variant and at a time when we have very high community transmission of this virus, I do think it's important for them to get tested. Now, there are different types of tests. There's rapid antigen tests, which have a higher rate of false negatives, right? So people test negative, but they're truly infected with the virus, but their rapid antigen test comes out negative. In those situations, in somebody with symptoms, if you have a negative rapid antigen test, you should absolutely get and request a PCR test. That is the gold standard of diagnosing COVID.
PCR.
Right. If you get a PCR test, we are not sending something out and something comes back later saying you have it, whereas you didn't have it originally. The genomic analysis that we're doing is is only being done in positive PCR tests. So if you come to the health department, where we only do PCR testing, you come to the health department testing site and we get a PCR test in you. If that PCR test is positive, then we will send it out for genomic analysis to identify what strain of COVID virus you're infected with. That doesn't change your diagnosis from no to yes of having COVID. That tends to happen more with the antigen testing, because somebody may have one of those false negative situations where they have a negative antigen test, and then the provider who's doing the antigen test sends their sample out for PCR testing, because that's really where, is, like I said, the gold standard to confirm the test.
Okay. Thank you for that explanation. Now, the next thing I want to say is, look, I'm not one of these people, I want people to get vaccinated. I believe people need to get vaccinated, but I am also a person who says this country is about choice and having the right to do what you think is right for you, right for your children, right for your family. So I am someone who believes I need to do my part, but it's not my job to mandate it on somebody else. Now, I do believe we need to take our advice from CDC, from science, from experts, and really from the governor and from people who are elected to do what's best for the people. So let me go with this. 30% of the beds are related to COVID, or the people in the hospital, 30% are related to COVID, Doctor.
You're taking that as a static number, so it peaked at that. So we're not at 30% today. I mean, it can peak at that level. So it's not, so if let's say we had 25 people in the hospital with COVID, that would be around 25% of
Okay, well, I'm sorry, I don't mean to, quibble over 30%, 25%. My point gets to be this. People have told me that, they get this shot and then they feel sick, the next day. And I have a son who's a scientist, and he does a lot of this kind of stuff, and I'm not going to bring him into the program as much as I'm going to say research on different types of vaccines can take years. I mean, this vaccine was rolled out warp speed, and I'm glad it's a good vaccine. But how do we know we're not getting some kind of side effects from these vaccines that's contributing to the other people who are in your hospital, the other patients?
So that's a good question to ask, is about, and that's a common question that was asked as the vaccines were being rolled out. So mRNA technology, the technology behind the Moderna and the Pfizer vaccines, which are the most common vaccines that we're using now for COVID vaccination, that technology has been studied for about 30 years. More than that, but 30 years from a medical perspective.
So warp speed doesn't fit for that.
No, it doesn't. We've been studying mRNA technology for decades. Because of those decades of research and scientific discovery related to use of mRNA, they were able to leverage it into a vaccine. And they had the funding to be able to do so. A lot of research on vaccines takes years because people run out of funding. All the research studies run out of funding. They have to wait several months for new funding to come. They have to restart their protocols. And that process takes a long time. The development of the vaccine for a non-mRNA vaccine takes months. But mRNA vaccines are different. They don't require the culturing, the constant culturing that some of the other vaccine platforms require. So these are high-tech vaccines, and so that's partly why the funding, the attention to it. We had dozens of companies focusing their whole workforces on developing mRNA or other types of vaccines for COVID around the world. So the attention, the staffing, the funding, and then the decades of research on mRNA that had come before the vaccines were even rolled out is what allowed us to move at that speed of being able to get a vaccine out in such short time.
Okay, well, maybe it's
Let me also just make a quick comment about that, because you're talking about anecdotal kind of evidence, and I really think it's important that when we look at these things, we look at it dispassionately to the science. But I'm going to give you an anecdotal factoid, which is that as I look at the hospital admitted patients with COVID, the vast majority are unvaccinated. Now, we know that there are people who get infected after vaccinations, but I really haven't seen, and this is not what I would call a dispassionate, scientific look at it. I haven't seen anybody who's been vaccinated really get seriously sick from it. So, and then the other point, to your point about we don't know whether it's causing any damage, you can never do a study as large as we've done, quote unquote, if you think about the fact that in the country, over 300 million doses of vaccine have been given. And there isn't data out there that shows that there's significant adverse effects from the vaccine. The mRNA that's injected, its half-life is extremely short, so it's going to be gone. I just don't see any evidence to that. And look, everyone can always think about what the worst part of the situation is, but the vast majority of the evidence here shows that the vaccine is effective, it's helping, it's reducing the symptoms, and that there's very, 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 very little evidence of any significant side effects.
Okay, I have two quick ones and I'll be done, at least for this part, because I have some more later. You talked about your hospitals you're part of MedStar, so you have people coming, maybe coming here and us having our residents go elsewhere for your services. And that's great. Thank God we have something like MedStar available to us in this area. My point is that are we getting out-of-county residents in St. Mary's County? You just said that you're not doing it anymore, but had we been getting out-of-county residents being treated down here?
So we haven't been able to accept anybody because we're on the other side of the equation. We're shipping people out because we're so full. If we had availability, we would still accept patients if there was a need to do that. Just from a operational perspective, we haven't been in that accepting capability at this time.
Okay, so we only have in-county residents. Okay,
Right.
And this one's for Dr. Brewster. And it has to do with this monoclonal and, again, excuse me if I mispronounce this.
That's okay. MAB.
and also with what I call the booster that they've been talking about. Now, I've been working in the Hollywood Volunteer Fire Department. My wife's part of the auxiliary, and they need a lot of help, and I'm glad to help. You had some people up there giving boosters, and that was great. Thank you very much. So I went over to talk about a booster, and the lady said, well, you have to be 6 months. Now, of course, I'm not 6 months, and it's not about me, but it's about people who haven't get 6 months. But I'll be 6 months on Thursday. So I said, well, seems pretty close. I mean, if I could get my booster, I'll get it. Well, you have to be
Yeah, so right now, boosters
immune or something like that.
Boosters are only approved for those with moderate to severe immunocompromise right now. And it's 28 days after their second dose, at least, that they have to wait before they get a booster dose.
Okay, so I wanted to know, how do you know if you're autoimmune? How do you know if you have that condition?
So there's a list of conditions that are typically considered moderate to severe immune compromise. We have those on our website or linked to.
Maybe they could bring those sheets so people could look at them.
You talk to your doctor, right?
Sure, yeah. I mean, the main thing is most people who have moderate to severe.
One guy went up there and got his shot. I'm sorry.
It's okay, go for it.
But one guy went up there and got his shot. He said, they never asked me if I was that.
They ask you when you register, right? So when you register for a vaccine appointment, we don't give vaccine appointments unless somebody registers in our vaccine registry system. The vaccine registry system.
They were doing it. They were doing walk up there because people came to the booth and said, hey, look, we're working at, I don't know, ice cream stand, whatever I was doing. Bottom line is someone comes up and says, hey, you want to get your booster? And if you got your card with you, well, I got it on my phone. I don't know. I'm still working on that. I'm going to get it. But this...
I'm not sure if it was somebody else doing vaccine, but when the health department does vaccine...
Because I walked over there, and those three ladies, very nice, very nice, were from the health department.
Yeah, you're required to register, sir. And when you do registration for vaccine, we may take walk-ups, but you're required to register on site. And when you do registration for vaccine, you get asked a question about immune compromise.
So they were probably registering on
Yes.
site then. Okay, thank you.
So if I could just piggyback on some of Commissioner Hewitt's questions. So we've all been vaccinated up here. I think we're all in agreement, all the commissioners in support of the vaccines. I agree with Commissioner Hewitt about personal choice. I think there's a lot of information out there and people can be educated about this. And I do encourage people to get vaccinated, but I've seen people citing articles and claiming that natural immunity gained from having had COVID is stronger than the immunity from the vaccine. Now, in my mind, you're kind of playing with fire there, trying to worry about that. But is there any data to back that up? Can you comment on that?
I definitely can go into it a little bit more. Is it okay if we go to the part about the vaccines where I can give some of those numbers, and then we can certainly address some of that?
I mean, we've kind of fouled you up.
Yeah.
No, it's okay. I think that's a great question, and I want to give some time to it, and I'm sure Dr. Michaels may be able to speak to it as well. But it may be helpful to get through some of this information because we'll cover a little bit of that.
I should have let you finish before.
That's okay. No, it's okay. I appreciate the dialogue.
We've had a lot of interaction, especially when I was at the carnival with so many people.
Yeah, understood. I appreciate you asking these questions so you can better answer your constituents. This is about where we are as a county by fully vaccinated status. About 53% of our county population is now at that fully vaccinated status. Next slide talks about the cases, and this is what Dr. Michaels was, of course, referencing, is that the vast majority of new infections that we are seeing in this time of Delta variant are in individuals who are unvaccinated. Yes, we are seeing some breakthrough cases. That is natural. No vaccine is 100% effective, and we think these vaccines might be less effective against the Delta variant than they were against some of the prior COVID strains. But we're hopeful that they'll also offer protection against future COVID variants that we may see emerge. The next one is hospitalizations by vaccination status. And again, the vast majority of hospitalizations are occurring in individuals who are unvaccinated. We are seeing some hospitalizations in individuals with breakthrough infections. And this is to be expected when you have high transmission and you're starting to see more of these breakthrough infections. But again, it's the vaccines are offering some significant protection against serious illness. The next slide is deaths by vaccination status. And again, the vaccines are offering significant protection against fatalities, COVID-related fatalities.
Is the deaths among the elderly or the younger? Is it?
So we have those broken down. The vast majority of fatalities are occurring in the 60-plus age range in our county. That was on a previous slide, I think, when we looked at the
Sorry, I
numbers.
missed it.
That's okay, no worries. So let's talk a little bit about your questions. If you can go to the next slide. It's about recommendations, and we'll talk to that in a moment. But I want to address your question about immunity. There are various ways our body mounts an immune response to some kind of foreign agent. And there's different mechanisms of that immunity, some of which we're really not able to measure very well. It is true that when you are infected with some kind of agent, whether it's a virus or a bacteria, in most people who are able to mount some kind of immune response, that immune response may be a strong immunity. It may be solid, good immunity in response to that agent. What we don't know is how long that immunity lasts. And with COVID in particular, one thing we've been discovering over the past several months of this pandemic is that this varies from person to person, and that the immunity that they're mounting, at least the type of immunity that we're able to check in the blood, seems to be disappearing a few months or declining a few months or some months after the infection. And because of that, and because there's so many variants on the horizon potentially, and there's new variants. This is a pandemic. It's a new virus, as Dr. Michaels is talking about. When you're dealing with a new virus, as opposed to something like the flu or the common cold viruses that we've dealt with before, we are even more concerned about new variants emerging when there's not immunity in the population. And so because of that, we don't know how natural immunity to maybe the Delta infection is going to protect you against other types of variants that may be coming down the road. And so that is the concern with natural immunity. What we do find, and what the studies have shown, including some of the more recent studies that have been released, is that natural immunity also wanes in time. And that individuals who've had COVID infection, yes, they may have some of them may have strong natural immunity, but their immunity, because it's waning in time, would benefit from vaccine after having infection if they've never been vaccinated. So if you've been unvaccinated and you've been infected with COVID, you may have strong immunity, and you may have strong immunity for a few months against the current variant that we have circulating, at least. And that's great. But we do recommend you get vaccination after having natural infection, because that vaccination helps boost that immunity so that it's not waning, as we've seen in prior studies. With vaccines, too, we are seeing some waning of immunity because of we're thinking probably 6 to 8 month mark is when there's going to be recommendations for booster doses coming out later in September, and I'll talk about that in a moment. And so with people who have vaccine-induced immunity, we do think a booster dose would be helpful as well to protect them and protect them not just against the Delta variant that we're experiencing now, but against what future variants may emerge that we'll be dealing with.
Yes. So what I like to tell people is that this is nothing new. Okay, we have known that immunity comes in an acute form and in a long-term sort of memory form. Okay, so right now, if you got vaccinated 6 months ago, you have a certain level of circulating antibodies which are ready and sitting right there waiting for the virus to show up, and ability to go and attack it.
Thank God.
Okay, but after a while, when there's no virus that's infected you, the body is not going to produce those antibodies all the time. Those antibodies are going to wane because there's no need for them at this time. And so you're left with what we call a longer-term immunity, which is called T-cell immunity. So your body has the map on how to make those antibodies, but they're not right there. And so if you get infected at that point, then it takes the body's got to gear up to make those antibodies, and that's why the severity of disease is less in people who have been vaccinated but still have T-cell immunity, because the body's already ready to ramp up. When you get the booster, as Dr. Brewster is going to talk about, that's going to then generate a bunch of new acute antibodies sitting in your bloodstream waiting for the virus to show up again and be immediately ready. So, and this is the same type of treatment that we do all the time. That's what we do every year for the flu. We try to vaccinate patients so that they are aware, their body's aware of what might come, and but they're still sitting there with a certain level of natural immunity to the flu, because we've seen that. 10 years ago, we were worried that the flu virus was going to mutate to a form where there wasn't any natural immunity, and that was a real concern. It remains a real concern. So vaccines needing boosters is a really well-known part of medicine for years. If you go out right now, if you've had chickenpox, you've got the herpes virus sitting in a dorsal root ganglion someplace in your body. As you get older, that immunity wanes, and you go and get the herpes shot so that you don't get shingles later on. So this isn't new technology. This isn't new theory. If you want to be safe, and remember what our goal is, to reduce the incidence of COVID, not only for your health, but to prevent a new variant from showing up on the scene that is beyond the control of what we currently have. That's what we need to do.
Yeah. Thank you.
Can I ask another question that I don't understand, but I want to ask it anyway? So I've had someone reach out to me about the CT number.
Yeah, the cycle threshold.
The cycle threshold. Can you explain this concept and what it means and what it is for St. Mary's County?
Yeah. So the cycle threshold is a very, unfortunately, misunderstood phrase. Basically what it is when you have diagnostic tests, you have to do, and like a PCR test, you're looking for this, without getting too technical, you're looking for this background fluorescent that turns the test from a negative to a positive test. And there's a certain number of amplification cycles you do to pick up on that viral RNA of COVID through that PCR test, right? So the PCR test is looking for a piece of RNA from the virus, or a marker of that. And so it goes through cycles to amplify and to try to find that virus within the sample. That's the cycles that the cycle threshold, or CT, refers to. Now, the tests that we have commercially available for COVID-19 in this country are qualitative tests. They are not quantitative tests. Qualitative tests are a yes or no. They are not meant to release or reliably indicate the number of cycles that you go through for each of those tests. It's not standardized across tests. So all of the tests that we have, and there's many that do PCR testing, all of those tests have different standards for how many cycles before they say yes to no, or how the cycle's even measured, and so forth. So you can't take one sample, like I can't swab your nose and take that sample and in one type of PCR test, get 30 cycles for it to turn positive, and then say, okay, well, in this other test, I only had 15 cycles for it to turn positive, therefore, or if I use, Commissioner Guy's sample in this other test, therefore, Commissioner Guy's sample is worse than yours, or something like that. You can't make those judgments with qualitative tests. We don't have quantitative tests commercially approved yet. There are quantitative tests for other things, like HIV, for example, but those are done in samples like blood samples, where the whole sample is homogeneous. It's basically the same throughout. When you're taking a nasal swab and you're getting mucus from somebody's nose, that's not a homogeneous sample. That's a really hard sample to standardize for something like cycle threshold. And so that's why we don't use cycle threshold. The tests are made to say, yes, you're positive, or no, you're not. PCR tests are the gold standard of testing. They are highly sensitive, meaning they have a very high likelihood of picking up COVID RNA if it's present in the nasal sample or whatever sample you're using. And they are highly specific. I mean, their specificity is awesome. That basically says that if it's positive, it's because of COVID, not because of some other virus in that sample. Now, there's also another misunderstanding. There are things called multiplex tests, right? Those are designed, and we do some of that at the health department with our rapid PCR testing. Those are designed so that you can take one sample and you can test it 4 times potentially for 4 different viruses. But the time that we check it for COVID is the time and the process that's specific for COVID. It's not going to turn out positive for COVID because there's a flu virus in the sample.
Okay.
Because
So
the
I've heard people
COVID
say
test,
that,
yeah, and it's a misunderstanding of what a multiplex test is.
Okay.
And also, the cycle threshold, like I said, is not something that you use in qualitative tests. There's a lot of things that impact it. It's not just the number of cycles to be able to pick up on the virus. It also depends on, how soon after somebody's infected did they get their sample taken. It depends on how well the person is collecting the sample. It depends on factors specific to the test itself. Again, there's different types of PCR tests. It could be the probe or the reagent that's used. All those types of things make a difference in the number of cycles needed for that particular test to turn that sample or to identify whether that sample is positive. So it's not a standardized value across tests, and that's why we don't pay attention to that. In fact, it's strongly advised against referencing or using cycle threshold in making any clinical decisions when you're using qualitative tests.
There's some confusion out there about the booster shots they're talking about. Last week, when we went down to Mako, the governor was saying everybody should get a booster shot. He's gotten his already.
Yeah, so...
The president has said the same thing. Of course, there's confusion about 6 months after or 8 months after.
Sure.
But there was 2 different things we heard that week. So are we changing that from...
I was going to make a joke about confusion and I don't want to go there.
If you, I thank you for raising that, and I appreciate you raising that, because you're right, there is a lot of confusion about that. And I actually have a couple points later in the slide set where I'm going to delve into that in more detail.
Okay,
If okay,
that's
we
fine.
can wait
That's
for
fine.
then?
Yeah.
All right, so I wanted to go through really recommendations for employers and facilities, and I brought this up at the last meeting, and I'm expanding upon it today, is that we are recommending that employers implement policy to encourage vaccination. Now, that could be through incentives for employees, that could be through requirements related to vaccine, but yes, we recognize that this is a massive public health issue of our time. It's having significant impact on education, families, workplaces, and we are strongly recommending that employers consider policy to encourage their employees to get vaccinated.
Many of them are starting to. Now, let me ask you this. Have we, since FDA now has approved the Pfizer,
Yep, fully approved Pfizer.
do you see an increase in our county of people?
We've heard about that anecdotally. I don't have any formal accounting of the number of companies that are or
You
not.
told me in the past that they weren't getting it because it wasn't FDA approved. I don't know.
Yeah, well, now it is.
So we will, at MedStar, we will require, as per the governor's order, we will require all healthcare workers be vaccinated by November 1st, and that was
All healthcare workers.
all of them.
How about the rest of your staff?
Everyone who works at the hospital.
Everybody works at the hospital have to get their shot by when now?
November 1st.
November 1st. Okay.
What happens if they don't? You gonna fire them?
Yep.
Oh.
That's a tough
Condition of
one.
employment.
That's a tough one.
It is a tough one. It is a tough one. It really is.
Tough environment.
Some hospitals have. Yeah.
It's a tough environment. Masking indoors. Again, we are strongly recommending that all employers or places where people gather, either work employees or the public come in for services, implement indoor masking. And this, I recall, Commissioner Guy, you raised the question about masking, and I answered it last time, and I'll go into more detail today. There is a continuum of effectiveness of different types of masks. That's to be, we've been talking about that since we were aware of PPE and really started talking about that in the beginning of the pandemic. We have thus far been recommending at least multi-layer cloth face coverings, at minimum. Multi-layer cloth face coverings that are well fit to the face, right, where there's not a lot of escape of air on the, loose, sagging ends, can be really effective at preventing respiratory droplets that are carrying the COVID virus, and even some of aerosolized droplets that are carrying the COVID virus. There's different ways that these masks works. It's not just about pore size. I know that people tend to focus on the size of the pores and the size of the virus. Well, these viruses are hitchhikers. They don't travel by themselves. They attach to water droplets, or they attach to smaller water droplets that make them bigger. And that's partly of how masks work. But masks also work through other ways. Masks also work through something called electrostatic filtration. And so again, it's not just about the pore size. This isn't pasta in a colander. This is about other functions of the mask that help prevent those droplets that are carrying the virus from entering the mask or exiting the mask by somebody who's infected. So if I'm infected and I'm wearing a mask, that's helping to protect you, as well as providing some protection for me. Again, there's a spectrum of effectiveness. In a time of Delta, where we have a highly contagious and high transmission of the virus, it may be prudent, especially for those individuals who are unvaccinated, to consider upgrading the quality of their masking. And one way to do that is to move into what we call a medical grade 3-ply surgical mask. All right, so a medical grade 3-ply surgical mask. In the beginning of the pandemic, we were really cautious about recommending this to the general public because we didn't have enough supply for our healthcare system, or we were concerned about that supply for our healthcare system. We now have plentiful supply of those medical grade surgical masks. And so if the general public wants to access them, they can purchase those types of masks. And that may be something to consider, again, especially in our unvaccinated population, because they are more effective at preventing some of that aerosolized virus from reaching the wearer. Again, those masks can't just be slapped on the face. Then you need to make sure they're well fit to the face and you don't have tons of air moving around where the gaps of the mask are. They do make the masks appropriate for kid-sized faces as well as adult-sized faces. Further along that spectrum is double masking, and we've talked about that months before as well. People have the option of combining their cloth face covering with a paper mask, and that might provide some additional protection as well. And then, of course, there are KN95s, all right? So KN95s are even a higher level of filtration material, and some people take that material and actually put it in their cloth face covering, and that also provides some support. But the KN95s are designed to be better fit to the face, and the material that they use are also designed to filter out more of what might be circulating aerosolized virus. They do make them appropriate for kid-sized faces as well as adults. There have been discussion about N95 masks, and N95 masks, which are really more intended for healthcare settings, and I do encourage all healthcare providers, especially in settings like hospitals and long-term care facilities, to routinely wear N95 masks at this time. And that is partly because we are seeing high loads of virus in those indoor settings. But N95 masks are effective because they're fit tested. You go through a test where you try different types of masks, and they actually check on the flow of air around that mask, and also because the type of mask that they are. And so those masks are very difficult for the general public to use because most of the general public is not going to get fit tested with an N95 mask. And so that's why our emphasis now is on those well-fit multi-layer cloth face coverings, perhaps with a filter inside them or double masking them, on those medical grade 3-ply surgical masks that are well fit to the face, or on KN95 masks that are also well fit to the face. In a time of COVID, when you're in those indoor congregate settings, it's even more critical that you pay attention to the fit and use of those masks indoors.
And how would you answer people when they say, well, wearing a mask continuously creates an environment of breathing in carbon monoxide or excessive amounts of whatever you're
You know,
Discharge,
healthcare
yes.
workers have been wearing masks continuously
I
for
did tell
hours and
this
hours on
individual
end,
that,
and
I
they're
said,
not passing out from
Doctor just
carbon
operated on my
dioxide.
eye in February. They all had masks on, and I said, my God, I'm glad they didn't make a mistake as they're cutting my eye up.
You know, there's ways to take breaks. Step outside, take your mask off. You know, in the schools, they're planning a lot of outdoor breaks to get some.
No danger of getting carbon monoxide poisoning by wearing a mask.
That's not what we're seeing, and that's not to be expected. And I'm sure Dr. Michaels can talk about that. I know that's a common misbelief, but that's not a concern that we have with masks.
I'm glad to hear that.
So carbon monoxide isn't produced by the body, carbon dioxide is produced.
Carbon dioxide, whatever it was the guy was talking
Right.
about to
So
me. And I said,
there isn't an
Almost said
issue.
doctors wear them all day long operating.
Yeah,
I said,
absolutely.
gosh, I hope they're not getting poisoned by their own breath.
And by the carbon dioxide, no. You know, people are breathing through these masks, clearly. We're doing it now, and we're presenting and so forth. And so there is movement of oxygen as needed in order to survive with these. It's not a glass dome that you're sticking on your face and sealing.
We don't want
right?
you all to be passing out pretty soon here, okay?
Yeah, hopefully not.
Don't do that, please.
And then, you know, of course, there's been concerns about bacteria and whatever, and, you know, wash your masks. If you're going to wear a mask, wash them. Don't leave them for 2 weeks with the same mask. And if you're wearing disposable masks, well, dispose of them periodically. I mean, they're not,
Right.
yeah,
Right.
so.
Okay.
All right, so the next items that we are recommending now for all of these facilities and workplaces, including schools, right, is ventilation. Ventilation is a key strategy in addressing a high amount of aerosolized virus that we're concerned about in this time, and as best as possible to keep windows opening. We're entering into, hopefully by the end of the week, we'll have less humidity, and we really hope that people will get those windows open and keep them open throughout the day, especially in our schools and in our classrooms. If you're not able to keep windows open all day, then at least, if you can, open them up for 10 minutes, you know, on a regular, frequent schedule, maybe at the end of every class. That would be a good time, a good signal to open up windows and try to air out the classroom a little bit. These are all multiple strategies, and what we're taking right now is a multi-layer prevention approach. We need to layer these strategies together because the combined effect of these strategies is what's going to help calm down the surge that we're experiencing now and hopefully prevent future surges.
The biggest thing is get vaccinated.
Yes, absolutely. Number one on top of there, get vaccinated if you can. But the people under 12 aren't age eligible to get vaccinated right now. And,
Okay,
you
so
know,
there's no vaccine for the 12 and under yet?
not yet, not approved yet, yes.
You know, it's a tough issue with school opening and masks.
Sure. That's why it's so important for us to
I'm
make
with
sure
you.
to have these strategies in
Small children,
place.
you know, masks are not like something that they,
I have a 5-year-old, and he does great with masks. And I know every child has different
great
abilities, and every child is at different ages, but, you know, children over 2, they acclimate, they learn quickly, and if they're, you know, if you tend to their needs and you give them breaks, and you take them outside to give them breaks, and you have other ways of making sure they have mask-free time that's done safely, they can handle it. Most children can handle
all come
it.
in shapes and sizes. They all come
Absolutely,
in
yeah.
different, you know,
Yeah,
so-
and I guess my point was to say that I understand that the challenges and the apprehension about that as a parent. I experienced that as well. But, you know, it can be done, and they are doing it successfully now. And certainly, children with disabilities have special considerations we need to consider, and those considerations are in place for their needs and to make sure it's not hindering their ability to function. HEPA filtration is another key strategy, and we are definitely encouraging workplaces, other places, if you can upgrade, and hopefully they've already done this over the past year, but upgrade your filtration systems as best as possible to HEPA filtration, or get HEPA air purifiers in place in your gathering, you know, shared spaces, including maybe even classrooms. That, again, is another strategy that, when layered in with all of these strategies, can have this cumulative net effect of really driving down risk of COVID.
I think we've done a lot of that. Is that what this machine over here is doing? Dr. Bridges?
It is.
Yes, sir.
hopefully it's doing it right.
It's supposed to be doing it anyway.
And then, of course, you know, in this time of high community transmission, as much as workplaces can accommodate teleworking or transitioning activities outside, we are certainly encouraging them to do so. The next slide is the testing slide. Again, no changes here from when I last presented. We are continuing to do COVID testing at our Leonardtown site, as well as the new hub site in Lexington Park. We went through the next slide already about monoclonal antibody infusion, but really just to add that this is intended for out-of-hospital treatment for those with mild to moderate symptoms of COVID within 10 days of having those symptoms, and is available to those 12 and older, not authorized yet for children. And it's mainly intended for individuals who have risk of severe COVID illness, and those conditions
Elderly,
that are listed here.
Would the elderly be
Yep.
more?
Elderly, 65 plus, although it is available to others, 12 and older, it's intended for people with certain risk factors for severe disease that I've listed here in this picture.
But let me just say, what you're infusing are the antibodies that you would get if you got vaccinated.
Yeah.
So the question about, would you rather have antibodies that were produced someplace else, or would you rather have your own antibodies? And, that's why I think it's so important to consider vaccination as the mainstay. This is effective. I mean, it's helpful. It's a treatment if you've got the disease. But the chances of you getting the disease if you're vaccinated is just another way to get antibodies. We're just bolusing you the antibodies.
So the vaccines are teaching your body how to make your own antibodies. So those are your antibodies that the vaccine teaches. That's what the mRNA is. It's a messenger. So it teaches your body, and then it disappears because it disintegrates. As Dr. Michael said, the half-life is low. These are antibodies that are created in a lab that then get infused through IV in somebody with COVID to help prevent them and to help prevent them from having severe illness. If you go to the next slide, please. Some updates on the vaccine front. The next slide, you've already mentioned, Commissioner Guy, and thanks for raising it, full FDA authorization for Pfizer vaccine. And those 16 and older, we're expecting the 12 and 15 group to be fully authorized soon as well. They continue to be under emergency use authorization. We expect Moderna full authorization will likely also happen as well. Their EUA was a couple weeks, I think, or a few weeks after Pfizer. So they're probably going to be on a similar timeline for full authorization. The next slide, please. Booster doses. So this goes to your earlier question. Thanks for waiting on that. The people who are currently eligible for booster doses are those with moderate or severe immune compromise. There's a list of some moderate or severe immune compromise conditions that we have on our website, that the CDC has on their website. It includes cancer patients. It includes individuals who are taking medications that affect their immune system. The recommendation for that group of people, and they are currently eligible, is for at least 28 days after their second dose of Moderna or Pfizer, they would then be eligible for a booster dose, right? The people who are not yet eligible for booster doses, but we anticipate they will become eligible for booster doses once the FDA authorizes it for them, we expect to happen mid to late September, are individuals in the general population who have received Moderna or Pfizer. What we don't know yet is an answer to the question, you raised this point, Commissioner Guy. Is it going to be 6 months after the second dose that it's recommended, or is it going to be 8 months after the second dose that it's recommended? Originally, the discussion was about 8 months, but more recent scientific research suggests that 6 months might be a better timing for that booster dose after the second dose. And we also don't know if there's going to be any recommendations yet for boosters for Johnson & Johnson. We expect that the booster recommendation will be for Moderna and Pfizer. We don't know yet on the Johnson & Johnson recipients. So stay tuned for that. What we did roll out on the next slide, yesterday we announced a portal for pre-registration. This is not an appointment for vaccine. This is pre-registration, so people can get notices from us at the health department as to when appointments are available and when they would be due, either for booster doses, which again is not yet approved for the general population, or for vaccines for children under 12. Again, that has not yet been approved. We hope that that will get approved sometime in the fall. That's still being determined, that timeline. But once those doses get approved, if people register their children under 12 on this pre-registration system, they will get an invitation to register for a vaccine appointment for their children. So for those in the community, we rolled this out yesterday afternoon. We already have over 1,500 community members that have signed up for this since yesterday afternoon. And this is a great way for us to assess what the demand will be so we can do appropriate vaccine planning. It's also a great way for people to sit back and know that they'll get notified and invited for an appointment when it's their time.
Is there an issue with supply?
Right now, we have good supply.
Okay.
But, it's going to depend on what the feds recommend at that 6-month mark or 8-month mark post-second dose. If it's a 6-month mark, well, then we've got a little bit of catching up to do.
But it won't be
because
like, you only got 1,500 vaccines this week or something like that.
Right now, we have good supply. Of course, when booster doses are rolled out nationally, the supply is going to get tighter, and we'll have to, that's why we're encouraging people to pre-register here, too, so we can better gauge what that demand is and order as needed. So if you go to the, and this is all on our website, we are planning, Commissioner Hewitt, you asked about this at the last meeting. So we are restarting operations at Hollywood Volunteer Fire Department for a mass vaccine drive-through site, where we start back, we have a few kind of isolated dates, and then we start back more regularly towards the end of September. And appointments are requested because, again, we are required to have people register in that vaccine appointment system before we can administer vaccine to them. And they can go on our website. We actually have a booster dose scheduled, a booster clinic scheduled for September 10th right now for those who have immune compromise at Hollywood Fire Department. Next slide, please. And again, major message here from today is to please get vaccinated. And if you've had prior infection, please also consider getting vaccinated, even if you end up waiting a few months before vaccine, because we do know that vaccine immunity boosts the natural immunity that can come after COVID infection.
Well, it's been 6 months since my vaccination.
Great. So when September rolls around and they've approved it for the general population.
I'm going over 7 months now.
Yeah. When September rolls around, later in September, and they approve it for the general population, anybody who was eligible, a couple months ago, based on that 6-month timeline, up to anybody who would be eligible at the end of September will be the ones that we'll be focusing on, if they roll out the 6-month vaccine recommendation. If it's 8 months, then most of the people who would be eligible at that 8-month mark after their second dose will become eligible in September anyways.
Yeah, what I would say, Mr. Guy, is that, you speak to your doctor, as you said, because if you've had certain diseases, they put you in that immune compromised situation. So certain types of cancer, certain types of other diseases really could put you at risk. So if you ask your physician and he or she says that you have autoimmune, then you're eligible now.
Right now, yeah.
Or some immune compromise.
I haven't asked her yet, but I might have to ask her.
Or, if you feel like you're immune compromised. I mean, so again, at our clinics.
I did have cancer, so.
Yeah, so if you can, you go into our registration system, for example, if you did it at the health department, you go into the registration system, it'll ask you a question.
Right.
Or are you immune compromised? It doesn't require a doctor's note. It doesn't require, you to have a letter from your physician saying you're immune compromised or any of that. But if you, as a patient, feel like you're meeting that range of moderate to severe immune compromise, or your doctor tells you that you are, then you mark yes. And if you mark yes, we'll go ahead and vaccinate you for your booster dose.
I have to have a conversation with Dr. Lee.
So, Dr. Brewster, Dr. Michaels, as you know, there's a whole spectrum of beliefs on where people are with this. For the people who are very concerned about COVID and have younger children, the parents might be vaccinated, but obviously the younger child is not vaccinated. Any recommendations on the level of isolation they should still be maintaining for their younger children versus, obviously probably not large crowds that are super spreader events, but what about extended family who's also vaccinated but not living in the same household?
The primary modes of transmission that we've been identifying through our contact tracing efforts are extended family gatherings.
Okay.
or gatherings like dinner parties or, families gathering together, and they're in close indoor environments in particular. There is some protection offered in the household because the parents are getting vaccinated. If you have children at home and they have health conditions like diabetes or asthma or any of these health conditions, it's even more important that you as a parent try to prevent introduction within that household setting, because we know that household transmission is the greatest risk of COVID. When you have somebody positive in a household, there's a much higher likelihood that everybody else in that household will get exposed and potentially get infected. If you have younger children who aren't able to get vaccinated, again, it's even more important that you as a parent and other adults who are able to get vaccinated, or children who are able to get vaccinated to help protect all those younger kids as well. In terms of what strategies you can employ beyond what I put on the slides there, the masking in indoor spaces is pretty critical. Moving activities to outdoor settings is also really important. But avoiding those outdoor settings where you have large groups of people congregating very close together that are from all over the place, because that's when your risk starts to increase. And we have seen transmission at places or events where people are gathering, even outdoors, in large groups very close together, and they're not wearing masks. The way you mitigate that risk is by wearing masks, avoiding the event if that's what you feel is needed. For example, if you can't wear an adequate well-fit mask, washing your hands, all the things that we've been talking about from the beginning of the pandemic. I think it's important for people to keep their kids engaged and this is why we are strongly in support of in-person learning in schools, because there's a huge benefit to that for our children. But we also recognize that there are risks in those settings in a time of high transmission, and that's why it's important that we implement all these other measures to mitigate that risk.
Thank you.
Two quick things. Sure. Commissioner President, if we're going to do these every 2 weeks, we need to allocate more than 20 minutes. This has gone well over an hour, so we're way behind. But I have a question for you.
Sure, sir.
We, as commissioners, have a fiduciary responsibility to our constituents, to the people, the taxpayers, that we know what their money is being spent on and how it's being used. And that's why about a month ago or several weeks ago, I asked you, I got an email from you at 4:41 in the morning requesting money that day.
Sure. It wasn't a request. It was just relaying the urgency of the request I'd put in a couple months before.
Well, a commissioner came into my office before that meeting and said, I want to give her $1 million today. I said, well, why don't we give her $2 million? Why don't we give her $5 million? Why don't we give her $500,000? Why don't we ask what she's going to do with it? My point is it's been almost, I asked you what was going to happen if you didn't get the money that day, and you said you were going to have to lay people off that day. I thought it was an emergency. As of today, you still haven't asked for it. Is there a reason why?
So, Commissioners, we know it's there, so that allowed us to keep the individuals we were going to lay off. It allowed us to keep them on payroll. Payroll comes, and there's a delay in that, right? I mean, you don't pay out, it takes a while before you have to pay out all those expenses. So I believe I don't know, I'd have to check with our fiscal team. I'm not sure where the process is with their invoicing the county.
And it would be helpful if we had some kind of pre-notice that you need this amount of money for this purpose, for hiring whatever the deal, because we need to understand that when we allocate the money, it's going to be used for what we're told it's going to.
Right, and it's being used. We have people on board.
Or yet, so it's not being used.
I'll have to check with our fiscal office, but knowing that it's there allowed us to keep the staff that we would have otherwise laid off. We're continuing, they're working for us now. We've hired on additional people to help us deal with this current surge. We're staffing up currently for the mass vac site that we're rolling out as well. So all of that is benefiting tremendously by knowing that $1 million that you dedicated is there. We do expect, the request that I'd put in for that funding was put in, I think, in May or early June. And again, the purpose of that email was not to implement a new request. The purpose of the email was to relay the urgency of that funding when I was discovering that it was taking longer than we expected for a decision to be made about that funding.
Thought you were going to have immediate impacts from the question.
We do have immediate impact, and we've been able to keep the staff that we would have otherwise laid off because we know the commissioners, all of you, thankfully dedicated funds to be able to support our surge response. So thank you.
Thank you. Thank you.
One more question on, I'm not medically qualified to really justify this, but don't you believe this COVID disease is going to be an ongoing thing for the rest of our life?
It may be.
Just like the flu, we've been getting
Sure.
flu shots for all my life, getting a flu shot every year.
Yeah.
And it mutates itself, and you try to give a shot that would best protect us from what you
Right.
believe would be the current flu type of that.
But we as a population have,
This is going to be the same thing. I really believe that we're going to have to get a booster, or whatever you want to call it, every year for COVID.
that may be the case. I think some of that's still being worked out in terms of when boosters are recommended, and right now they're working out when boosters are recommended right now. Keeping in mind that this is a highly infectious virus. It is, especially the Delta variant that we're dealing with now, is more infectious than flu virus. And over time, over decades of having flu virus in our population, we've developed some level of natural immunity. People have gotten vaccine, people have gotten infected. All of those things contribute to some baseline level of immunity that helps protect us every year as we deal with small changes in the flu virus and as we tweak the vaccine of the flu virus vaccine so to better meet those small changes in the flu virus for that year. We are not there yet with COVID. We need to develop a level of control of this pandemic first worldwide, and then be able to maintain some level of immunity against that virus so that we can deal with the tweaks in the viruses that may happen over years to come. But we don't, we're not there yet. We haven't reached that baseline yet, and that's why it's so critical for people to get vaccinated now.
I don't know what else we can do to convince people to get it. Now that it's been approved, FDA, Pfizer at least, I say get vaccinated. So we'll see. And your push to get the whole hospital staff vaccinated by November 1st would probably help out a lot too.
Yep, so, yeah, we will accomplish that. We're running continuous vaccinations for
That's great.
our associates.
I'm not sure we are at with our people and our staff, but most of them, I think, have been vaccinated, as far as I know. We pushed a lot in our government staff, so we're doing pretty good. Well, thank you all very much. Anything else, commissioners?
No, that's all.
Okay, well, thank you all very much for your time and information here. It helps us to make decisions and hopefully convince the people to get vaccinated.
Thank you, sir. Thank you all very much for your time.
Thank you.
Thank you, Dr. Michaels.
Thank you.
All right, I move to adjourn as the St. Mary's County Board of Health and reconvene as the Commissioners of St. Mary's County.
Second.
I have a first and second. All in favor? Aye. Ayes have it.
Thank you, Commissioners. Next.
Going right into the main agenda, Office of the County Attorney. You ready to give your presentation?
Oh, yes, Commissioners. I'm before you asking for you to authorize a public hearing to repeal the solar moratorium that was put into place back in March of this year. That was done to allow the Solar Task Force to issue their final report. That's been done. Land Use and Growth Management is in the process of creating new rules and regulations in the zoning ordinance to address the large-scale utility solar, and hope to have that done in the next 60 days. So I believe when Mr. Hunt presented the final solar task force to you all, the commissioners had expressed a desire to repeal the solar moratorium. So
Mr. Weisskopf, this was always intended to be a temporary moratorium, and it just seems kind of silly to me that we have to go through the public hearing process to end this moratorium. Can we not just make a motion this morning to end it and be done with it?
it's by ordinance. An ordinance requires, what happens is this was a moratorium on Chapter 285 of the St. Mary's County public, local laws, which are via ordinance, and ordinances were, the zoning ordinance is Chapter 285, and that requires a public hearing.
So if we just waited till December, it would just end on its own?
Correct.
Well, I move to schedule a morning public hearing to repeal ordinance 2021-15.
Second.
I have a first and second, all in favor? Aye.
I
Any
don't wait till
opposed?
December.
Well, I don't want to wait till December either. just don't think we need a
Ayes
public
have it.
hearing.
Oh, well, I know. Okay,
you.
next we go right into the county administrator time.
Thank you, Commissioner. And next is the draft meeting agendas for September 14th and September 21st. On September 14th, please note that it starts at 1 p.m. You have the invocation and pledge by Commissioner Hewitt, approval of consent agenda, and a couple of proclamations. One is the National Forget-Me-Not Month, and the second is the Hispanic Heritage Month. Commendation for American Legion Post 255 baseball team that were the 2021 Mid-Atlantic Regional Champions. And you also have a Department of Land Use and Growth Management request for a public hearing for a comprehensive water and sewer amendment for property on tap, and then county administrator time, and then St. Mary's County Board of Health, and then commissioner time. And on September 21st, at 9 a.m., you'd have the invocation and pledge by Commissioner O'Connor, approval of consent agenda, 3 proclamations, Constitution Week, Underground Railroad Month, and National Senior Center Month. And then at 9:15, the Office of the County Attorney for the public hearing to repeal the solar moratorium ordinance. Then a presentation for the St. Mary's County Fair and Sustainability Awards by the Department of Land Use and Growth Management. And then the Office of the County Attorney for Legislative Proposals, County Administrator, and then Commissioner's time. And looking at your County Administrator items today, the first will be the State's Attorney's Office for the Maryland Department of Human Services Cooperative Reimbursement Agreement. And I note that we also have the Deputy Daniel White on the line as well.
Good morning.
Good morning.
Good morning.
Good morning.
So today we're here for our annual representation of the cooperative.
Excuse me, could you move towards your microphone?
Oh, sorry.
Thank you very much.
We're here for the annual cooperative reimbursement agreement that we receive, which is a federally funded grant that assists with the expenses of the Child Support Division of the State's Attorney's Office. And today we would like for the Commissioner President to execute the fiscal year 2022 cooperative reimbursement agreement from the Maryland Department of Human Services on behalf of the State's Attorney's Office, Child Support Division, in the amount of $815,745, and also to approve and authorize the Commissioner President to execute the related budget amendment to revise the budget in accordance with that agreement.
This seems to be something we do every year.
We do, and we were here last week. Thank you very much for the proclamation, because this grant and this program helps collect that $13 million in child support every year.
Very good. I move to approve and authorize Commissioner President to execute the FY 2022 Cooperative Reimbursement Agreement, Project US 2211, from the Maryland Department of Human Services on behalf of the State's Attorney's Office Child Support Division in the amount of $815,745, and also move to approve and authorize the Commissioner President to execute the related budget amendment to revise the budget in accordance with the agreement.
Second.
I have a first and second, all in favor?
Aye.
Any opposed? Ayes have it. Thank you very much.
Thank you.
Have a
Thank
good
you,
day.
Deputy White.
Thank you very much.
Next is the Department of Finance for the St. Mary's County Metropolitan Commission, Department of Housing and Community Development, DHCD loan application package, and we have George Erickson and Jeanette Cudmore.
Good morning, Commissioners. I have with me George Erickson from Metcom, and he will discuss his application from DHCD not to exceed $10.3 million. Thank you, George.
Erickson, thank you for wearing
Good morning,
purple today.
Commissioners. No problem, sir. You have an informational memorandum in your package dated August 13th, 2021, and we're here today to request your concurrence with an application. It's not a bond bill. It's an application for a low-interest loan from the Department of Housing and Community Development, which is required by the Code of St. Mary's County, in particular, Chapter 113.2C. Christy Hollander, our Chief Engineer, and Patty Stigman, our Chief Financial Officer, are on the Zoom meeting. And thank you, Elisa, for making that happen for us today. If you have any specific details. Our board approved the application package at their regularly scheduled meeting last Thursday. And with your approval, we would be able to go to loan closing in November of this year. And I would like to make just a couple of points associated with this application. The first one is you notice in the informational memorandum that we hope to receive an interest rate of between 1% and 2.5%, which is really good interest rate. We also wanted to advise you that the loan that you approved in 2019 for about $7.8 million, every one of those projects is moving, whether it be under design or construction, which is further a testament to our promise to you that we wouldn't be borrowing unless we were ready to go. This application is no different. There are 7 sewer projects and 5 water projects. Some of them are prior approved capital budgets, and some are 2022 capital improved budgets. Not all of prior approved capital projects, not all of our 22 capital budget projects are in this loan because they're not ready. So we only have 12 projects that we're requesting as a part of this loan. Also wanted to point out that our joint efforts made effective July 1st of this year with House Bill 862, which allows both the county and the Metropolitan Commission to incur additional debt. This is not impacted by that. Our debt calculations that were provided to you earlier this year as part of the budget calculations were not part of this House Bill 862. The Metropolitan Commission does not intend to use that additional authority or even ask the commissioners to use that additional authority. We want to maintain our internal cap that we currently have at $120 million. We need that extra buffer in case there is an emergency or something happens. We'll have the capability to borrow, and you'll have the capability to say yes and be able to back us in good faith and credit as opposed to supply us with money that we may need. And we think that was a big step for the Metropolitan Commission, and we thank you for that. Also wanted to report, as you'll notice, the last comment on our informational memorandum to you talks about a prior loan refunding. It's called refunding, not refinancing, but it's really refinancing. We were able to secure a 0.096 interest rate. That's pretty much free money. That saved our interest. It saved us about $1.1 million in interest. But what I'm here to really report is to thank you again for approving another resolution for our recent reborrowing. We just closed on that loan, and we took interest rates that were up as high as 4.3 and brought them down to 1.79, saving another $2.2 million for our ratepayers. So in the last 2 years, between the Metropolitan Commission and your authorization, which you have to authorize, it's strange when you refund money you've already borrowed. It's still borrowing again, and we have to come before you, but we really appreciate you giving the nod to us on that. That's $3.3 million of interest we saved in 2 years, so hats off to the commissioners for supporting us. I don't know that I have anything to add to the particular request today, other than St. Clement Shores Water Phase 2 is on the list. Town Creek Water Phase 2 is on the list. We've learned some lessons in Phase 1 in both those cases.
And that's Phase 2 of 7 phases, is it?
It's 4, I believe.
Okay. I just know there's a lot
4 or
of
5 phases.
Town Creek.
And we're having ongoing dialogue with the Department of Public Works, obviously. There's another project called Shangri-La Drive, Essex Waterline Project. We just learned recently that there is an ADA project that the county has down in that area. Well, obviously, like FDR Boulevard, we don't want to be in there with our contractor, you be in there with yours, have issues associated with timing. So we're trying to work out a joint project there because we don't want to tear up the sidewalks and the roadway after your ADA project is complete. And likewise, we don't want there to be a large gap between the two projects. So we're thinking, it's in the early stages, John is behind me, but our staff is talking to each other about trying to make that a joint project. So it's one contractor, one point of responsibility. If it's not successful, we share in that non-success. But if it's not successful because of one of us, that gets to be a little bit more difficult to manage. So we're looking forward to that as well. And the Pine Hill Run project, I don't know if you recall that. It's our access to Marley Taylor Wastewater Treatment Plant. We had a contractor who we thought paving prices were a little bit out of line. We had our procurement folks call your procurement folks. You saved us about $80,000. We removed that from our contractor's scope of work, and we tied into the county's scope of work, and you were able to save the Metropolitan Commission about $80,000. So, you know, it's a big day of thank you from us to you. And again, we appreciate your support over the past few years with all of our projects and with all the coordination.
Tremendous. Great job.
Well, Mr. Erickson, it's also a day to thank you. We appreciate your help with the issues we've been having out at St. Clement Shores with the water pressure. That's always a quality of life issue. When you turn the water on, take a shower, people like to have water pressure. Now, I do want to say a couple quick comments, and I'll be quick. First one is $10,389,000, that's a lot of money. Are these projects shovel-ready? And here's what I mean by shovel-ready. When I went to MACO, got a little bit more definition, you probably already know this, but they said it's a project that can start in a year. It's not that you have to have a permit in hand, but you've done enough preliminaries to know that you can start within 12 months. So are these projects in that same scheme?
Most of the loans are 3 years. They give you 3 years to expend the money.
I understand.
And we front fund almost all of our designs to make sure that when we get the loans, we're reimbursing ourselves for the design on the loan so that the construction can start.
Good point. That's a lot of what I determined to be shovel-ready. 6 years ago, when we found out that Metcom had $51 million worth of undrawn loans, it was costing their ratepayers about $2 million a year and interest on money they couldn't use yet. So that's been something you personally, and thank you very much, have paid attention to. What's that undrawn down to now? I didn't see it in here. Or if it was, I missed it.
In here somewhere.
If Patty can chime in on that, I did bring that. It's an odd thing to mention because it's a certain $50 million we have borrowed since then, so I try to track that separately, but we have one large project left from that. It's about $6.3 million.
That's still the water tower?
No, it's the Pine Hill. No, it's not. It's the Pine Hill wastewater treatment or wastewater pumping station, I believe.
All right. Well, you can follow up later with the undrawn, just so we know for sure. I move to approve the Metropolitan Commission's request to submit a loan application for the funding of prior approved capital improvement project through the Department of Housing and Community Development, DHCD, in the amount of $10,389,122 plus cost of issuance and administrative fees, in accordance with Section 113-30.2.c of the Code of St. Mary's County.
Second.
I have a first and second. All in favor? Aye. Any opposed? Ayes have it.
And I hate to leave unanswered questions. Commissioner Hewitt, $5.396 million.
You're down to 5.3?
Yes, sir.
That's a whole lot lower than 51 million, buddy.
Yes, sir.
That's a lot better. Thank you.
And the majority, again, is the one project that is on our list next.
You got it under control is my point.
Thank you,
Mr.
sir.
Erickson. Done a great job. Thank you very much.
Thank you, Mr. Erickson. Next, we have Mr. Art Shepard, Mr. Dietrich, and no less than 3 doctors, I believe. Dr. Comey, Dr. Murphy, is that Dr. Murphy and Dr. Roach?
I guess if we have a condition with health or a condition with education,
We're all here.
all right, how you doing, Dr. Roach? Nice to see you, sir.
See you, Dr. Roach.
Dr. Roach, how you doing today?
Good. How are you?
Good. Very good. Very good.
Commissioners, good morning to you. A long time coming, but we're glad we're here. We're all excited about this potential lease agreement that, looking for your authorizations that between the county and College of Southern Maryland and Recreation Parks has the opportunity to manage the wellness and aquatics facility on the CSM Leonardtown campus. What I want to do is just some brief introductions and then turn it over. Maybe Mr. Comey has some marks of where they are, the College of Southern Maryland, their thoughts on all this, and then I'll go briefly through the memo of the summary memo for any questions you might have. Is that fair?
Sounds good.
Sounds good.
Okay, so certainly you know I have with you the Vice President of Operations, Dr. Comey here for College of Southern Maryland. It's who I've been working with through the entire time. What a facilitator, what a gentleman, and that's moved us forward. And the Board of Trustees with the College of Southern Maryland, Dr. Roach, and in the audience is Dr. Murphy, the President of the College of Southern Maryland. Delighted she's with us. And then online we have our Recreation Division Manager, Jessica Hale, who's been busy at work with getting the staffing, the facility, and working with the College of Southern Maryland staff, and then Marva Kump, who is our leisure and wellness coordinator that will be on site with other staff, our FTEs that will be there to make it all happen. But I also have to say, too, That IT, Bob Kelly has made a heavy lift there with getting us there through our IT components, our laptops, our computers, televisions, all the wiring, everything that's necessary. Excellent spirit of cooperation there, and as well as Department of Public Works and John Dietrich and that staff with consultation and other items to make sure the facility operates as smooth as possible on our end. But I will have to say once again that Dr. Comey and the staff there is not just saying, here you go, we're not invested. They're not saying that at all. They want it to be a success. They're working with us, even though it's a lease agreement. I would say fantastic partners. So with that, Dr. Comey, I'm going to let you jump in and say a few words about where this all leads and where it stands with you in the College of Southern Maryland.
Thank you, Mr. Shepard. The college, about 2 years ago, started to take a comprehensive look at our facilities and our facilities footprint. At that time, we identified some facilities that were underutilized and ones that we thought we should try to see if we could get a little more bang for our buck. One of those was our Wellness and Aquatic Center here at the Leonardtown campus. We started looking out for community partners that we could come together with to try to enhance the number of customers, number of clients that are using the facility, and we started some conversations with Recreation and Parks because that seemed to be a natural fit, that there was not an indoor pool facility in this Leonardtown, central St. Mary's County area. We are serving that population, a similar population of rec and parks, but in some ways we felt that branding our swimming program and our fitness programs as college classes were not as open and inviting to families with younger children and others in the community. So started having discussions with Rec and Parks about, is there a way we could come together to increase the number of St. Mary's County citizens that utilize the facility and get a better return on investment that the college has put into the building, the state's put into the building, and the county has put into the building. Those conversations have been progressing very well over the last year. We're here today with an agreement that we think is going to be beneficial to St. Mary's County and to the college. The agreement provides a way for Parks and Recreation to come in and manage the facility, to offer programming the facility, but at the same time let the college continue with some offerings in the facility as well, so we fully utilize the building and have a much better return on investment. We're very much looking forward to it, and I've been very pleased and happy to work with county staff on putting this together.
Great.
Okay, thank you, Dr. Comey, very much for that. As you can see in the summary release, when this is approved today, that we can gain access to the facility tomorrow, and we plan to open on Monday, September 13th. We have adequate staffing there for both wellness and aquatics. One of our challenges, though, moving forward is just like we have at Great Mills Pool, is hiring on additional lifeguards to meet the needs there. That's we have a modified schedule at the Great Mills Pool to that coming out of COVID and having lifeguards there. But, you know, we've been open the entire time at the pool, so we know we'll be successful here. Our therapeutic classes and some of the staff from the College of Southern Maryland has come on in the hourly side to work. But we're excited about that we can begin on September the 13th. This is a short-term lease, 2 years to look at it, up to 5, so that is advantageous to all of us. And you can see what some of the facility costs there that we're going to incur there and with the College of Southern Maryland. And you can see their great support through utilities and landscaping and the outdoors of the complex. But we'll take on some of the direct costs, custodial services, and then some of the costs up front that Mr. Kelly, Bob, and the IT department's doing. And I even heard the words that they were excited to get in there and get this moving forward. Then we get to the enterprise fund side. We're not asking for any FTEs. We told you that from the very beginning. We're moving staff out of the Patuxent building there. Marva will be in there as the site person. Once our therapeutic recreation specialist is hired, that'll be their first home base on that site. And then some of our other office staff. We did find out that we can manage well through teleworking. So to communicate in 2 different buildings, we can do that now, and we think we can find great success. So you look, I gave you some fees and charges there that you can look at. Our overall budget, we work with Ms. Cudmore Finance. All that's in the enterprise fund, and we are anticipating approximately $50,000 loss the first year. Now, what does that really mean? That we know we won't be at full capacity, and there will be fixed costs associated with that. You're going to have a certain amount of lifeguards, whether there's 10 people in the pool or 20, all the different things, cleaning that goes along with that. So with those fixed costs, but yet we do, and if we do have a very, very strong retained earnings account in our enterprise fund, over $500,000. So if we can go to that and then a net loss possibly, it might not even be that. We hope to break even, and if not better, to be honest with you. And we think that once the synergy gets there, they're open and people realize that we will grow, and then by a year or two, we'll be turning over a net, or what we call a profit, in the enterprise fund. So I think that gets you up to date. You have the email there that explains most of that, so I'll entertain any questions you might have.
So, Dr. Comey, Dr. Murphy, Dr. Roach, thank you all. I think this is phenomenal. This is a huge partnership. I know there's been a lot of work, and it's taken a long time to get to where we are, but this, I mean, as you pointed out, this is a building that was built by the citizens of St. Mary's County, and they're going to be able to use it and make use of it. And I think this is really good. I think it's good for the college, and hopefully we can tap into some of the college to recruit new lifeguards and make use of that. I think this is excellent. So thank you all.
Okay, I had a couple quick questions.
Yes, sir.
As a former business owner, sometimes when people go out of business, you say, well, what happened? And if I'm going in there, how can I make it work if they couldn't? So, Mr. Comey, can you tell us, you're in Leonardtown. You're in the central part of the county. You've got an affluent population in this part of the county. Why wouldn't it work?
So I'll go back to my statement earlier. When we advertise college classes. So we advertise, and everything a person takes in the facility from the college is a college class. I just think from a marketing standpoint, from a branding standpoint, that was not tapping into the full potential of what Rec and Parks can do. Rec and Parks can have birthday parties in the facility. They can have mom and baby swim in the facility. It's a totally different way to market those kinds of services. So I think that in some ways, by having it as college classes, was limiting the market potential.
Okay, that's good information. So next part would be, will college students still be able to use it for free, or part of the college you'll have some discounted? Will they be part of this enterprise fund?
Right. So the partnership that we've developed, the college is still contributing significant dollars to managing the infrastructure of the building, all the utilities of the building, the security of the building, et cetera. So as we're looking at that exchange of values, one of the things that we've incorporated in the agreement is that college students and college employees could continue using the weight room and the pool during open hours, not during parks and rec classes.
Okay, so you'll have some what's the term, separation.
Limitations, yeah.
Yeah, because what I was concerned about is that if you only have so big of a facility, and you have college students using it, or the college people, let's say, using it, and you also have the general public using it, is too many people trying to use it at one time.
You're right, and so we've discussed that. But initially, we believe that with the fitness center, the exercise room, and the open swim pool, there is enough space there, and you're not adding an additional cost. But if a college student says, I want to sign up for a particular class, then it would be pay. Now, if the day does come where that we're squeezing out people that do pay, that's where we'll be talking about that again and potentially modifying the lease, because that could happen. On the onset, we don't believe it will.
Okay, that's the 2-year kind of touchy-feely.
That's right.
Because I say this, Mr. Shepard, I've never went into a business project where I expected to lose money. I've always expected to at least break even or make money. So again, that's my wheels turning in my head. And I guess my point is when I read this to hear, well, we're going to take over something that wasn't working for the college and we're going to lose money on it, it just didn't sound like a good combination to me.
But maybe the first year, but after that, we don't believe we will, and that's evident in our strong $500,000 enterprise fund that we have. That's our return earnings.
All right, well, we'll keep a good eye on that.
We will, indeed.
Yeah, I know
a lot of people are excited about this coming up. I mean,
and it's important to remember we're not a for-profit operation. anyway. This
Not
is
for loss either.
We're not for loss either. But I mean, you sat in the MACO sessions with me where they said county government does not operate like a business operates. And
Well, this is an enterprise fund, which is supposed to break
And
even.
They've got experience of managing it very well.
We're going to keep an eye on you.
Love it.
I know my pastor at St. Joseph's Church decided about it. Father Drew used to swim every day there in the early morning.
No, people want to do it.
They're all looking forward to this happening. And it's numerous of the elder community, including myself. I don't really use a therapy type thing, but they were upset when the therapy was sort of cut out for a lot of them, and now they're very excited about getting back to it again. So we thank the partnership we have with the college and with our Rexford Park Department. And that's good. Thank you.
Delight.
And thank you, Dr. Murphy, for yours. And our side is here. You're number 15 in the country.
Yeah.
Wow, it's amazing. Absolutely amazing. You
Yeah.
hands out to your leadership there and everything that's made our community college such a big hit in the country. Good.
Okay. I move to approve the lease agreement between the Commissioners of St. Mary's County and the College of Southern Maryland, with which designates the Wellness and Aquatics Center on the Leonardtown campus as a fitness, aquatics, and recreation center managed by the St. Mary's County Recreation and Parks Department, and improve the fee schedule and budget amendment, and authorize the Commissioner-President to sign any related documents.
Second.
I have first and second. All in favor? Aye. Any opposed? Ayes have it. Great partnership. Thank you all very much.
Thank you.
Thank you, Mr. Shepard. Next, you have from the Department of Emergency Services a request for a reorganization presented by Director Stephen Walker, and Kelly Bell and Jay Mattingly are on Zoom, and Catherine Pratson is here as well.
Morning, Commissioners.
Good morning.
So as we know, our Department of Emergency Services is growing, it's evolving, it's changing quite a bit. Me and the HR Director, Ms. Pratson, have had a number of discussions on it. One of the areas that we talked about was Fire and EMS Recruitment Coordinator. That's Ms. Kelly Bell, that she does a lot of work for the fire departments and EMS. We got into some discussions that we thought it may be advantageous to move her over into my department so that she could assist and do those duties for our personnel as well as we do hiring. But I think there's a number of other duties that she could be helping with. Mr. Mattingly on the line, of course, is he's kind of transgressed and moved over to doing quite a bit of background investigations for us and assisting. He does a lot of recruiting, does a lot of public relations, as she does. I think the two positions can work very well together, and our request is to come before you and ask to reorg and reassign her into our department. It is budget neutral.
It's just shifting around from one department to the other.
Makes sense to me.
Let me ask you, how are we doing with this getting the ambulances out thing? Is that kind of calming down?
We're doing well. The north end is still a challenge.
Okay.
I believe it's because of the veterans home that we are staffing. So when the people are supposed to be there, they're out. The problem is that they are out running other calls, and then we run short. So we are still getting some mutual aid from Charles, but that really is the problem area for us, is the north end. So we're doing well.
I know that's non-related to this, but again, having worked with the Hollywood Volunteer Fire Department Carnival, those issues come up, and it's like,
right.
Where's this commissioner at? I said, look, I want to help you. I want to support you. Let's just get this under control.
This does support that, because again, with all the hiring, we've hired a number of people. We're still completing backgrounds, and Ms. Bell will assist Jay Mattingly with that quite a bit. Again, it really melds well with what she already does. It really does with the recruiting part of it and dealing with all the first responders. So.
And Ms. Bell, I know you're on the Zoom there. They speak very highly of you. Those volunteers like her. Thank you for what you're doing.
Thank you.
Okay, I move to approve the transfer of the Fire and EMS Recruiting Coordinator to the Department of Emergency Services with the reorganization as proposed, and the related budget amendment to realign accounts in Emergency Services Support Fund, and authorize the Commissioner-President to sign any related documents.
Second.
I have a first and second. All in favor?
Aye.
Any disapproval? Ayes have it.
Thank you,
Mr. Walker, thank you very much also for your coordination of the EMS ambulance at the Crab Festival.
Yes.
They had 3 calls out of
Yeah.
there.
Really?
Yes.
Yeah.
I don't have any more. We had one
Heat
guy
stroke.
that heat exhaustion, and one guy fell over and hit his head on the table. And
Wow.
so they had, and I came with the other call. There's 3 of them I know out of the festival that day I was there.
Very good. Very
So
good.
I appreciate having them there. I bet there was 2 there at one time, Leonardtown and your unit there. I
It's okay, that's good.
really appreciate it. Thanks a lot.
Sir,
Thank you, Commissioners.
Thank you.
Thank you, directors.
I want to reach out to you offline sometime, and get 10 minutes of you here.
And that concludes the county administrator time.
Okay, well, let's get right into Commissioner time. We'll start with Commissioner Hewitt.
Oh, good, thank you. Did attend the Crab Fest. Commissioner President Guy was there with his crab hat on. It looked great, looked great. Nice crowd, very hot. I was glad there was a lot of people there. It's a tradition in St. Mary's County to have our Crab Fest and, Lions Club, and they're having their vision and hearing screening and things that they do. So it was another, I use the term return to normal. Thank goodness we're getting some returning to normal. Even with the variant kind of ticking up, we're getting some return to normal. I keep talking about the Hollywood Volunteer Fire Department Carnival. Great crowds, a lot of people, a lot of kids. It was a lot of fun. It's great being a volunteer and helping out. Those volunteers with that fire department and auxiliary, thank God we have them. I'm not sure if Ridge, do they have their carnival this year?
They do.
Is it next month?
It's coming up in September, yep.
All right, good. Attend if you get the time. They need it. Those people work hard. And again, their fundraisers have been restricted, if that's the term, or tamped down a little bit by the COVID. Be careful. Wear a mask if you feel like you need to have one. But please, get vaccinated. Next, this past week, we had our OPEB LoSAP meeting, and I know I keep talking about that a lot. And the reason I keep talking about it a lot is because it's one of the things that is a big expense out there if you're not ready for it. Your bond rating agencies look at that to see how you're ready to pay your retirees. And the good news is, this week, we found out that we have more than met the number we've been trying to meet for OPEB. It was supposed to be 106. It kind of jumped up to maybe 112, 115. It keeps moving around because we hire more people. That makes it go up. The good news is we've hit our goal. And we've been very aggressive, is the term I'll use, in the last 6-7 years, trying to get to that goal. But we've gotten there. Now, people may say, now that you've gotten there, what are you going to do about it, Mike? What we're doing about it is we're taking the foot off the gas pedal. We used to be in the top, 1 through 100, we used to be in the top 10% of people getting returns, 13, 14, 16%. Great returns. But now we're down in the 90%. And people may say, Mike, that's a big drop. What have you done? Well, here's what we've done. We've shifted our strategies from maybe a moderately aggressive form of investing to a more conservative form. Look, we've gotten there. We've met our goal. It's very important that we keep it and that we make sure that our expenses are around 3%. So we need to keep 4, 5, 6% because we need to keep that goal. It'll free up more money for other projects in the county. Lastly, I want to say happy birthday to my daughter, Christina. Today's her birthday. Happy birthday, honey. I hope it's a great day. Make Nathan take you out for a nice dinner. And Maddie, Eva, and Charlotte, you be nice to your mama. Thank you.
All right. So as of right now, it looks like the worst of the remnants of the hurricane are going to pass to our north. But if I was you, Ida, be prepared for a lot of rain and weather. See what I did there? Ida, be prepared. It's pretty good. Come on. So the Crab Fest, I was able to attend the Crab Fest too with my family. It was a lot of fun. A huge thank you to the Lions Clubs and all their work with that and all the sponsors that made it possible. Saw Commissioner President Guy there working. He was busy and doing good work there. I want to tell you about one particular part of it, though. So we got there early for it, and we were in the food court area, sitting down for our meal and enjoying our time there. And right at 12 o'clock noon, they had the singing of the national anthem. Now, what they did is everybody. If you've been to the fairgrounds before, you know that the food court is probably one of the busiest places no matter what the event is, and there was a lot of people there. Everybody stood up. Everybody was silent for a moment. They had a moment of silence because there's a lot of stuff going on in our country and around the world, and it was awe-inspiring. And then the girl that sang the national anthem, she was 11 years old. Her name was Mallory Kearns, a student at Mother Catherine Academy. It's one of the best renditions of the national anthem I've ever heard. Great job, Mallory. It was incredible. It brought chills. Everyone was silent. It was a very moving moment, and it was really good to just be out at the Crab Festival, being able to see that. Happy Labor Day coming up. Get a long weekend for a lot of people. I hope you're able to enjoy it. It's the unofficial last weekend of summer, so enjoy it. Have a good weekend. And my most important comment of the morning, happy anniversary to my wife. Today's our wedding anniversary, so happy anniversary. Thank you.
Your anniversary today, and here you are at a meeting?
I know.
What is wrong with you?
That's how we celebrate.
He's doing his job, and that's good. Even though it's his anniversary, he's here working for the people of St. Mary's County. I think that's commendable right there itself. Now, I want to thank everybody. I'm a member of the Leonardtown Lions Club, and we had a great festival. I haven't got all the figures to tell you, but I do know one thing. I was actually pouring the beer most of the time with my job, and we try to practice, safe thing. We told everybody, so okay, we're going to pour the beer, we're going to set the beer on the table, then you can grab it. No touchy with anybody. So it worked out great, but we poured more beer than ever before. I suppose it's because it was hot that day and warm, but
your TAM's qualified, right?
Everybody was drinking beer, and I mean, my gosh, that goes with crabs. That's the way it is. And so I appreciate those who came out there. We had a great attendance. We hope nobody. We did have a few people that had problems, and I'm not messing about the animals being there. 3 were taken to the hospital. I know 2 of them was heat related. The other one, I'm not sure what it was. But thank you all for coming out there and supporting the Lions Club. This money all goes towards charity, and plus servicing our. We go around to all the schools in the local area every year and give hearing and sight testing, and mainly hearing is our big thing, and sight. I mean, actually visual is a big thing for us, and but we do that every year. And then the rest of the things, charity. We have a Christmas type of gift exchange we do every year, things like that for the community. So thank you for that support. Thank you to our sponsors who our best year ever. Our sponsors came out and did a great job, and we appreciate it very much. And you're right, that 11-year-old did a heck of a job singing. It was amazing how well she did. It was very, very moving. And I appreciate the whole crowd. Like I said, it was just total silence, which you don't usually hear around there with all those people there. So it was really great. So with that said, I'd like to entertain a motion to enter into closed session.
I move to enter into closed session to discuss litigation.
Second, I request a 5-minute break.
Okay, we'll have a 5-minute break, and we'll get into closed session, and we'll do it right here. Right here? We'll do it right here. Okay. Take a 5-minute break. Meeting adjourned.